Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Let's go!
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, no positive attitudes, behavior, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Good morning, everyone. I'm Jackie.
And Coach Patrick.
Guys, welcome to Help Matters live podcast where your help matters.
Yes. Join us right here every Saturday at 9 a.m. as we bring you relevant information pertaining to your health and well-being. We'll have healthcare professionals and other professionals on the show to assist us in helping you to be the best you that you can be as it pertains to your health and wellness.
So, guys, make sure you go to Get Fit with Jackie Fitness page on Facebook and like our page. Also, subscribe. Hit that button, YouTube channel at Help Matters, Jackie and Coach.
Yep. Happy birthday to everybody celebrating a birthday in this great month of February. This is a short month, so we're halfway through it. Happy birthday. My sister had a birthday. Well, two of my sisters had a birthday this month, and my brother had a birthday this month. George, Phyllis, and Junior, Rufus Jr.
Also, our son-in-law had a birthday.
Our son-in-law, yeah.
Had a birthday.
Happy
yes.
birthday.
My mother's birthday tomorrow.
That's right. Valentine's Day.
Well, my mother's birthday was Valentine's Day.
We're pre-recorded, yeah.
Yes, guys. Yes. And my brother's birthday was this week as well on the 15th. He was born the day after. So they are in heaven.
Awesome.
Yes.
Happy birthday. And happy anniversary to everyone that got married in this great month of February. Tied the knot, jump the broom. However you did it. Enjoy. Continue to become one. Continue to celebrate and love each other and build your family. Any anniversaries you know of?
Marcel and Valina Palmer birthday. They celebrated their birthday on their anniversary on Valentine's Day. They got married on Valentine's Day, so they celebrate that.
The month of love.
Yes.
Happy anniversary.
Happy anniversary.
Most definitely. If you would like to be a sponsor, a partner, or a friend of the Help Matters broadcast, call 706-592-8862. We would love for you to help us do what we do every Saturday at 9 a.m. right here on Help Matters podcast. All right, we got a special guest this morning, Jackie.
Yes, we got our no other than Dr. Dan Jolich. Aiken Chiropractic. Welcome, Dr. Dan, to Help Matters. Good.
Yeah, it is.
Hey, how you guys doing again?
Hey.
A little slow on the trigger this morning. That's okay. How you doing, Dr. Dan?
Good, pretty good.
Awesome. I tell you, we're just coming off of the WOW event. We had an awesome time, and we thank you for joining us at that WOW event. And we had a great time, good showing, and some awesome speakers, and we had a good time.
Very good. Yeah, I enjoy being there.
Awesome. Thank you. We appreciate it.
Yeah.
So we're talking about vertigo.
Dizziness. Yeah.
We talk about a lot of people dealing with that. Been talking to a few people about that. Just tell us a little bit about it, Dr. Dan, and break it down.
I thought we'd talk about that. It's something that a lot of people have issues with. As we go through aging process, we lose the sense of balance a little bit more. So there's a lot of studies being done in that arena. But you can either have problems with vertigo or dizziness. They're very similar. Mm-hmm. One of them is you feel like you're standing still and everything around you is spinning. And the other one is everything around you is still and you're the one spinning. So that'll be the vertigo. But they're very similar. They're caused by, similar, conditions, basically. So they talk about, vertigo and such, that's really called vestibular neuritis. And so there's a nerve called vestibulocochlear nerve. And so it's all connected to the spine. And that's why chiropractic can actually help. But the nerve goes to your middle ear. And inside of the middle ear, there is a vestibular portion, there's a cochlear portion. So, one of those is for hearing, but the other one is for the sense of balance. So it's real simple. I mean, if the nerve that goes to your middle ear is irritated somewhere along the way, that particular nerve, vestibulocochlear nerve, is also one of the cranial nerves. And we call them cranial nerves because they come out from the neck area and then they give a little branch and they go back into the skull. The skull is called the cranium. So there are 6 pairs of these nerves, cranial nerves. There's actually 12 of them. And they are, named by Roman numerals. So the vestibulocochlear nerve is cranial number 8. So basically, we can talk about the interruption of the signal coming from the spine and into your middle ear. And they say there affects quite a bit of people in the United States every year.
Wow.
So sometimes people can have a sudden severe vertigo where they have this like spinning sensation. They can have nausea and vomiting sometimes, difficulty concentrating, nystagma. Nystagma are this little involuntary eye movements, so that can happen as well. Now, that can be more acute or it can be chronic. And if it's a chronic, it can lead into lightheadedness, mild dizziness, nausea, can even have difficulty in walking. And it can be like a feeling of like ringing in the ears and mild motion sensitivity, also anxiety.
Wow.
So that symptoms do vary from person to person.
Mhm.
So this is not a condition. This is just a condition, but it's not like a disease. So it's not contagious.
Mhm.
It doesn't. It's not like genetic. It just happens.
Dr. Dan, one thing
Mhm.
I'm thinking about is how often, if someone has vertigo, do they have to, deal with the dizziness and deal with things spinning around them? Is it every time they stand up, or is it, is there something
Yeah, so
happen?
the symptoms vary on person. Somebody can have it all the time. Somebody can have it. It's a positional thing. They can stand up a certain way or or stand up from sitting too fast. They can have it. Or maybe if they lay on their back, they're fine. But when they turn over and go to the left or right, they can have it. So it
Wow.
is positional, and it does vary. From person to person.
Okay.
So there's a lot of different things. But when we look at all that stuff, chiropractic, like if somebody with vertigo, dizziness symptoms, comes to my office, we'll do an exam. We will look at a past history. I want to see if they have any history of stroke or some
Mm.
kind of head injury. We take X-rays. X-rays are done to look at the pathology. So we'll take the X-rays of the neck area, and we also look at the inside of the skull. There could be some type of a tumor that's in the brain that can be causing this. It can be sitting on the nerve as well. So things like that. So you have to really look at it. Also, history of migraine headaches can contribute to vertigo or dizziness as well. It's somewhat related to that. So that's what we do. If
Wow.
we are, not sure about it 100%, then we will order an MRI. I order MRIs pretty much every week. However, the X-rays are, pretty good for most of the time. We have digital X-rays. So to really come up with diagnosis, you will look at the front to back and then side to side X-ray. So 2 pictures, and you look at
Mhm.
some relationship inside of the cervical spine. We cannot see the nerves on the X-rays. We can only see the bones, but there's openings between the bones where the nerves exit from every level. They exit the spine. So if those openings are too small, then of course that's probably the area where the nerve is being irritated. So that's what we need to look at. So those are the kind of things we look at. Now, MRI will be useful if there could be a suspicion of maybe a bad disc or herniated disc. That's typically with people in acute trauma like car accidents, slip and falls, things of that nature. Being that I practice in Aiken, I get people that fall off of horses and that happens, and then they end up having some of the symptoms. We can help them too, but we have to, rule all that stuff out.
Hmm.
So all of that is important. Now, the test that we do in the office is for cranial nerves. Like I said, this is a cranial number 8, so there are a couple of tests that we do it for that as well during the exam. We also do range of motion, reflexes, things of that nature, and we're gonna kind of come up with, what's wrong with that. So if you look at the medical way of treating this kind of condition, vertigo, dizziness, well, they kind of want to treat the symptoms. They say that when I did a research on this, the Cleveland Clinic, for instance, says that the main goal of vestibular neuritis treatment medically is to manage the symptoms. So
Mm.
they're just going to do medication and maybe some physical therapy. That's kind of what I do. So they may order some anti-nausea medications or some medications to reduce, feelings and pain, inflammation, and sometimes even antiviral medication. So some of the medicine they use for nausea would be Zofran and Reglan. Those are the commercial names for these pills. But that's really all they do. They just
Right.
treat it with, medicine, and their goal is to treat it with, just to treat the symptoms.
Right.
So,
And I would imagine that it's probably based on the extent of the vertigo, how
yes,
how bad it is for a person. I've heard of something called vestibular rehabilitation, and it said it's a
yes,
type of physical therapy. I know you mentioned that can benefit people with
yes,
inner ear or balance problems.
it can. So what we do a little differently in chiropractic, we don't treat the symptoms. We actually want to treat the cause of that.
Right.
So that little nerve, cranial nerve, comes up from the neck area, and we can look at that on the X-ray. And if the opening is small between the vertebrae and the vertebrae is out of alignment, and you can see that on the pictures, that's where the pressure is occurring on that nerve. Now the nerve then sends a wrong signal into your middle ear, and the little crystals in the middle ear, they just kind of go in the wrong position, which is our internal GPS. And when you have this situation, your body just doesn't know exactly where it is in space, and that's why you either have vertigo or dizziness. So it's just not sure where it is. So
Wow.
what we got to do, we need to take the pressure off of the nerve, and I've done that so many times in my office over 20 plus years. And it's usually you check the upper cervical area between the atlas and axis. Usually that's where the pressure is. And the reason for that is when you look at the anatomy of the cervical spine, there are 7 bones in the cervical spine plus the occiput. Occiput is the base of the skull. So these nerves exit from every level, and then some of them go back into the skull. They do different things. That's why they're called cranial nerves. But this particular one is the cranial nerve number 8. So what happens is if he gets irritated at the nerve root level as he exits the spine, it's going to send the wrong signal, into the middle ear, and then everything just goes haywire. So medication doesn't correct that. I mean, it is a mechanical type problem. Mechanically, the
Mhm.
nerve is being irritated, being compressed upon by this vertebrae, which are the bones of your neck that are out of alignment. It's very, very simple, really. But you need to take away that obstruction. That's what we do.
Mhm.
And then
Mhm.
the body will simply heal itself.
That's
So
good.
I've seen people come in and after just one adjustment, they instantly stop having vertigo or dizziness. But it does take more than one sometimes. So it just depends on, the person, what kind of work they do, what kind of stresses they have in their lives, and also, how long they had, these symptoms before they seek help. So one of the things we also encourage in my office for people that have, vertigo dizziness, we need them to reduce or stop, preferably stop, some poor habits that can also irritate the nerves. Things like smoking. They shouldn't be smoking. Smoking irritates stuff. The reason why smoking is bad in a lot of ways, but it's also
Yes.
irritating these nerves. Yeah, and there's some receptors inside of our nervous system that the nicotine that's in a cigarette attaches to, and it inhibits the natural transmission of the nerve impulse. Actually, it's so common or it's so strong that those receptors on the nerve cells are called nicotine receptors. So that's pretty interesting. So nicotine receptors are going to be, taken out by nicotine in a cigarette smoking, and it's just not good, So they need to stop smoking, or at least reduce it. But
That's
really,
right.
it's better to stop smoking.
Stop.
Drinking alcohol is another thing. They should not use a lot of alcohol. That's also irritating to the nerves. Another thing we ask them is drinking too much caffeine. So,
Mm.
there's a lot of studies that show that coffee actually is beneficial in some ways, but not beneficial in other ways. But it depends on, how much do they use, and also
Right.
it's not just coffee. There's caffeine everywhere. It could be in the soft drinks and other drinks like those energy drinks, which I think are terrible, but people use all this. So the amount of caffeine irritates the nervous system when it's too high, that needs to, go away.
Mm-hmm.
Overeating processed food, that's another thing. We have to talk about the diet because processed food has chemicals in them and they affect everything in the body, including the nerves. And that can also be a little contributing factor to things like, dizziness and vertigo. So, we talk about that as well. And sometimes we actually have to talk about them taking a non-prescription medication. People tend to, buy, over-the-counter stuff thinking the problem's going to go away, but it doesn't. And if you take like Tylenol, Advil, or any of those medications, it says on the bottle that if the symptoms persist for more than I think it's 12 days, then you're supposed to stop taking that and go seek professional help. So a lot of people don't. They're just hoping it's just gonna get better, but it usually doesn't. Then eventually they come to it. So all of that really. So these kind of bad habits can weaken the body and it can trigger the episodes of vertigo as well. So
Wow.
we need to really, talk about that as well. One of the exercises we talk about medically that do physical therapy, and I'm, nothing against that. That's fine. But we also talk about yoga. Yoga is really good. It's stretching. Your body needs to move. You're not going to be healthy if your body is difficult to move. So you have to move constantly. And I don't know if I talked about it on the radio, but just recently I read another. This is a medical doctor website, and they said, you got to walk every day. So, what would be the number of steps that's, recommended every single day? Well, the number is 10,000. So every single one of us should try to walk around at least 10,000 steps a day, which I know it's not easy every day, but if you do it most of the days, that will probably be good. When I work in my office every day, when I work with patients the whole day, I get a lot more than 10,000, sometimes up to 16,000. So I'm happy with that. But days when I'm not working, I do have to, do something more, and we got to watch that as well. So 10,000 steps is what you need to do in order to stay, healthy as well. So, yoga helps because it helps with the stretching and just the regular movement. And these movements can actually help body to learn balance and control, and they will also strengthen, the body. So what we do overall, besides all this extra stuff I mentioned, we look at the symptoms, we look at the history of problems, bad habits, all that stuff. What we really do to correct this is we, diagnose, we analyze, and we correct the issue with the vertebrae being out of alignment, in the neck area. So that's what I do, and Dr. Ellison in my office as well. So, we adjust the neck. But chiropractic is very specific. So, maybe not all 7 vertebrae in the neck needs to be adjusted. We need to just adjust the ones that are, out of alignment and they are causing this irritation and leave the other ones be. So typically the upper cervical, like atlas, axis, which is the second one, and then that occiput. I started to mention the reason why a lot of the tension occurs in the upper cervical area. That's because by design, we do not, as humans, we do not have any discs to cushion between occiput and atlas, and between the atlas and the bone below it called the axis or C2. There is no disc there, and that's by design, because if we had the disc there, we wouldn't be able to turn ahead so much, it
Yeah,
wouldn't be
makes
possible.
sense.
Yeah, so we got that, more mobility to have more range of motion. And the way we're designed, the second bone in our neck, or C2 or axis, kind of has an extension in the middle like my thumb. That's called the dens. It's also called odontoid process. And then the atlas looks like no other vertebra, no other bone in the spine. It looks like a ring. And the atlas goes around that process. And then you can turn around it like this, so we can, turn the head like this. So that's why we're designed with that. But because that mobility is allowed, the atlas can do something no other bone can do. It can go a little bit sideways like that. it can get stuck in the wrong position sideways.
Mm.
And that's
Oh,
called laterality. We call that laterality because it kind of goes sideways. And no other bone can do that. So we have to analyze that area and take the pressure off the nerves right then and there. So, I don't know if you know, but like, other animals like say dogs or cats, they can't turn the head like this. Dog looks at you, he kind of goes like this, he goes sideways, but he cannot actually turn the head like we can because their spine is different. They don't have the same, top part of the neck like we do. So, it's kind of interesting, but so that's why it's so important, to check that. We check, of course, what I do in my office, I check the whole spine. Every time a patient comes in, I kind of like to analyze the whole thing and see what's wrong. So for the vertigo, yes, I got to check the cervical or even more specific upper cervical area, but I check everything else because this upper thoracic area is what supports the neck. So if that's kind of crooked or something's going on there, it's just going to keep popping out of alignment. It's not going to really stay there very long. So I really want to correct that as well. And then if the pelvic or the lower back, instead of being leveled, is kind of off, one way or another, well, that unlevels the spine and the spine can start to, curve like this. So we need to really affect this. So I explained it to patients. Listen, it's not just about treating, symptoms. It's really about correcting the structure, and you have to look at the structure as a whole because it's all connected.
let me
And,
get in for a
mhm,
second, Dr. Dan, because I like how you saying, how people will get are quick to get medication, but it only
yeah,
treats the symptoms. But
that's
when
it.
you come to chiropractic care, you can actually relieve those nerves, and help them not even, experience the vertigo symptoms versus just giving medication to mask, the symptoms and treat the symptoms. You actually treat the issue.
Exactly, exactly. So that's really why I went to chiropractic school because I thought it's really cool that you can do things naturally by correcting things and not just, treating the actual symptoms. If you just treat the symptoms, when you look at it from philosophical standpoint, you're never really fixing anything. The
Right.
problem is there, you're just diminishing it so the person is just
Right.
not aware of it. And this is why a lot of problems over time become chronic because, pain that we experience and the symptoms that we experience in our lives are natural. Your body is basically telling you, hey, something you're doing is hurting me. Can you please stop and fix it? And when we go ahead and take, pain medication or anything like that, the medication chemically disconnects that connection between, through the nerves between the brain and whatever part of the body that the nerve goes to. It just disconnects it. So the
Mhm.
brain doesn't register what is going on. So that's the problem. And so over
Wow.
time, yeah, over time, you are more likely to just continue with the same, bad habits that you had up until then. And when the medicine wears off, a lot of people are a lot worse than they were when they first started.
Right.
So then they try to do more stronger medication. And then after a while, that doesn't work. And then it's time for, injections. And then
Yeah.
when that stops working, then it's time for surgery. So,
Yeah.
And then medication has all kind of side effects
Yeah.
also.
Because
it
that's what
does.
the body recognizes. Like you said, it
Yeah,
doesn't recognize what it's supposed to do when
that's
you
the thing.
treat the root. So it
That's the
only
thing.
recognize the medication. So it
Yeah,
identifies with this supplements or the,
yeah.
the medication.
I mean, there's place for everything. There's place for
Yes.
medication as well. But
Right.
as far as the treating this kind of symptoms, if it's a mechanical type problem, which that's why I stay busy in the office. I mean, I'm busy, and people are looking for us all the time because a lot of them have that kind of a problem. It's like something is compressing, irritating the spinal nerves as they come out of the spine, and there are little holes on every level between the bones, and those little holes can be smaller than they should be when the bones kind of get out of alignment and they're not moving. So we have all these bones in our spine, and the reason why that exists is the nervous system is the most important organ system in the body. Think about it. It's the only organ system that is so important to the body that's completely protected or encased in the bone. So your
Hmm.
central nervous system is your brain, and it's encased in the cranium, the skull. And then peripheral nervous system is the spine, spinal cord, and that's completely encased in, spine, in the bony spine, to protect that. But if we didn't have all these bones so they can move separate, we will not be able to move. It will be stiff as anything. So that's why the spine has so many, movable segments.
Mhm.
But that can cause issues over time as well. So, that's why it's important to move. Nutrition is very important. Exercise is really important. Sleep is very important. All of those things we always mention, 5 factors of health. He always goes back to that, because it's pretty simple. But that's basically one of the reasons vertigo or dizziness occurs as well. And that's what we do. If somebody just wants to get rid of the symptoms for a little bit, maybe some medicine will help them for a little bit, but it's going to keep coming back. If
Right.
the if it's caused by the spine, and that's really common, we can just fix that. We can just put it back in and back to normal. So that's kind of what we do, or what I do as a chiropractor. I mean, I'm trying to change the structure and get it back to normal. That's all there is.
That's
That's
good,
why
Dr.
there's,
Dan.
yeah, that's why there's
And
really, yeah,
go
there's really very little side effects to what we do. It's all natural. I mean, I'm doing it very gently. I'm doing it really good. But sometimes maybe somebody can get sore for a little bit and then it goes away. I mean, that's possible, but it's not going to be very long. There's really no big side effects to what we do. So,
Right. I just like how you paint the picture when you talk about the spine and you talk about the nerves, because the spine is, like you said, is like a conduit for the nerves, and the nerves touches everything.
Yeah.
It
yeah,
touches everything in our body, and so many times we get a headache or something like that, or something's aching, we run and take medication for it. When
yeah.
if we was doing chiropractic care, we can relieve the tension and the pressure off of those nerves, and we'd be fine.
Yeah. So definition of nervous system. Nervous system controls and coordinates the function of every living cell, organ system in our body. That's what it
That's what
does.
I'm saying.
It's a
Yeah,
central computer. And that's why it's completely protected by the bone to keep it, from being injured. And so, it's also the basic, the spine itself is the basic framework that everything attaches to it, like all the muscles, everything attaches to our bony spine. Everything hangs off of that. So it gives you a very, very good framework. So if your frame is just not right, how are we gonna, live? That's the problem, So you got to look at that and you got to take care of it. And here is why we got to be really careful with the spine and why we have to take care of it. You cannot get a new spine. I mean, you got what
can't
you
do
got
it.
the rest of your life. It got to last you the rest of your
Yeah,
life. I mean, they can give you a new kidney. They can even have surgeries where they replace the heart. They even have like a, artificial heart, and people live with that for some time. Not
mhm.
full life, but and I think that technology over time is going to get even better, where maybe people live long lives with artificial heart. But there is no way to replace the spine, because it's so complicated. And
Right.
so, I don't think that's ever going to happen, or if it's definitely not going to happen during our lifetime. So take care of it. It's the only spine we're ever going to have. And actually, the less you mess with it, the less surgical things we do to our spine, the better. The less we mess with it, the better, because there are
That's
side
right.
effects to all that stuff.
Right. Right.
So it will be important to just, preventative care. That's the message here. Do prevention.
Yeah.
And unfortunately,
Absolutely.
yeah, and unfortunately, we got to be a little smarter than the insurance companies wants us to do, or government wants us to do. You know, um, in our country, a lot of it is about money. It's a lot. It's about profit and all that. It's sad, but that's where we are.
Mhm.
And so the insurance companies don't pay for preventative care. Most of them don't.
That's it.
You
You're
know,
right, Dr.
and,
Dan.
yeah, and I asked that
You're
when we
absolutely right.
had, yeah, some seminar I had before. We asked the questions like, hey, how come like, Medicare or Blue Cross Blue Shield doesn't pay for like regular visits, like once a month or once every 2 weeks, like the year round? Why don't they pay for that? Because that will save money over time. Because if you do regular maintenance, you will have less problems with the body. We would definitely as a country have less needs for, really serious surgeries that cost tens of thousands of dollars, not to mention rehab and medication, everything involved after the surgery. So, why not do small things and be able to, prevent that from happening? We will save ton of money. And the answer I got was this. The insurance companies, healthcare insurance companies, are insurance companies, the same as insurance company for your car or for your house. You buy a car, it's a brand new car, and you get insurance for it. the insurance is not going to pay for your oil changes. It's not going to pay for replacing your tires. It's not going to
Preventative.
pay for regular maintenance of the car. But
Right.
something bad happens to the car, it's going
Mhm.
to pay to get it fixed. That's
Right.
how it is. So insurance functions, healthcare insurance functions with the same model. You
Same
have to
way.
have some kind of a loss in order to have insurance covered. Isn't that
Right.
crazy?
I never looked
So
at it like that.
yeah,
But that's
that's
where it is.
Mhm.
that's how it is.
Wow.
So they're treating us like objects. It's what it is. They're just doing that to make money, but they don't really care that the difference between your body and say a car is one day the car you're gonna sell it. You're gonna get a brand new car. But you can't get rid of your body. You can't say,
Right.
okay, I want a new body. You can't. You gotta keep
Mhm.
the one you have.
Right.
So really, you gotta kind of make a decision what you're gonna do as a person about your own health, and follow through with that,
That's
and
it.
not just wait for somebody else to do it for you because that's just not the way the system works.
Yeah.
And
Yeah.
people say, well, how come the government doesn't help us? Blah blah blah. Yeah, well, if the goal of government is to, save us and stuff, why do they still allow selling cigarettes? I mean, we know cigarettes kill people. I
Come
mean, it's on
on.
the packaging. And
Yeah.
you can go to the, corner store and buy a pack of cigarettes, no problem.
Yeah.
So they don't care. They just want
Certain
the money and the
chemicals in
taxes.
food.
Yeah,
Yes.
it's pretty
Certain
sad.
chemicals in food is no, it makes no
Yeah,
sense to put 14
yeah,
ingredients in one
yeah,
type of food. It
yeah.
just it doesn't make sense.
It makes no sense, but that's where we're at. And actually, I read about it. Why do we, or when did we start doing all these preservatives in food? And the answer is World War II, the end of World War II. What happened was,
Wow.
before World War II, our food wasn't processed. It was more natural and everything else. World War II happened. A lot of the Americans went to the war. I don't know, 10 million or whatever it was in the armed forces. The war ends. All these GIs come home, and then the country was doing really well. Our country really prospered after World War II ended because we were one of the victorious parties, and we really kind of rose up as a major power. And the economy was doing great. Everybody was living really good. So that's why you had baby boomers, the biggest generation. A lot of people had babies. So it was just it was a population boom. And our government realized we cannot get the food fast enough from where it was made, from the field to the grocery store, whatever. It was spoiled.
Mm-hmm.
So they told the government, like, hey, we need more time. So the government said, okay, we're going to allow you to put some preservatives in there so that the food wouldn't spoil. And we need to feed our people. So that was like the way they thought about it at the time. Now it's all about money. And if you go buy food that's processed, it's gonna have all kinds of chemicals. So
Yes,
I'll
absolutely.
tell people, you buy a juice, if it's shelf stable, if that bottle of juice is on the shelf, it's
Chef
got
life.
preservatives in it. Yeah, it's got
Yeah.
preservatives in it. If it's
Yes.
a fresh juice like orange juice or something, I mean it's gonna be in the refrigerator section. It can only last so long.
Right.
But if it's not, I mean that puts stuff in it to make it last that long. It's
Yeah.
Absolutely.
incredible. So
Yes.
we need to be smarter than that.
Yeah. Make better choices. Make the best choices that
Yeah,
we can make for our health, and we got to be the responsible and
Right.
accountable and own our health. We have to take
Definitely.
back
yeah,
control of our health. We can only do so much,
Mm-hmm.
but
yeah,
if we just do a few things differently, that can make a difference in our quality of life. And
Right.
that's what we have to tell people. You can only do the best that you can do with
Mhm.
what you have.
And
yeah,
here's the thing: if you want to have preventive care, it starts with you, the
yeah,
individual.
Yeah.
And you have to, put your best foot forward on making sure that you put things in place for your health and your well-being. So, Dr. Dan, you gave us a lot of information on vertigo and dizziness. You always give us some bonus stuff when you talked about the food and stuff. So
it's
we
all
enjoyed.
connected.
Kind of go together because he's
Yeah,
a nutrition scientist, so it kind of goes
Yeah.
together.
yeah, it
So
does go together. It's all connected.
Yes.
So talk to us about the power of wellness before we go away, and give the people your contact information so they can get in touch with they can chiropractic.
Yeah, well, that's why I came up with a Power Wellness years ago. We have quite a few people on it because, if somebody gets injured and they want to seek chiropractic care and they have, say, Medicare or they have some kind of insurance that only pays for a few visits until they feel a little better, then we got to stop. And then if
Mm.
the patient says, well, I love this. Can I keep coming, once a month or once every 2 months or whatever? Yeah, of course you can, but I cannot bill Medicare or your insurance for that because that's considered wellness care, and they don't pay for that.
Right.
So then we say, okay, now we have Power Wellness, and for that, 4 visits a month, $79. So they can do, one visit a month if they want. I forget the amount of money, but that's a little bit more per visit, but it's still really affordable. And that's what we do. We got to switch them to that plan. And some people actually choose Power Wellness right from the start because it's actually cheaper than a lot of people's copay and deductibles because
Yeah,
we
that's
have
awesome.
to collect those.
Right.
So when you tell them, hey, this is how much it is from your insurance, or you could do Power Wellness for this much, ooh, they love it. And I'm allowed to do that. There's something called a TOS, time of service discount. In other words, they got to pay me just right then and there as they're
Mhm.
about to get treated. They
Mhm.
cannot be billed later, and then I can legally give them a discount from my standard fee, and that's how
Mhm.
we do that. So,
That's
so yeah,
awesome.
it's called Power Wellness, and you can go on a website and read about it. But a lot of people use it because really everything's so expensive nowadays. I haven't raised the prices or anything, and I don't think I will just yet. So we're
Okay.
good so far. But yeah, so aikenchiropractic.com, or you can call us 803-641-9191. We've been getting a lot of people. There's a way to contact us, and through our website. So almost every day, I get a website form notification through email that somebody did it, and they usually write down what their problem is or what the initial complaint is, and then we call them and see what we gotta do for them. But yeah, they can do it to the website, or they can just call the number, and we'll be happy to assist.
Awesome. Now, Dr. Dan, those 4 visits that you get under the Power of Wellness program, do they have to be done within a month, or can people
Yes.
stretch them out?
So it's up to four, I like to say, for $79. That's basically once a week. So if somebody likes to do that, then that's just under $20 a visit.
Okay.
Like I said, if they feel like they need to come, let's say once a month or once every two
Mhm.
months, then it's a different price for that.
Okay.
It's of course a little bit more per visit, but it's still really good deal
Right.
comparatively speaking. So they can call our office and find that out. It's
Gotcha.
pretty easy. And there is no month to month, they just pay me. And then if those visits run out, they can, re-up the next month, they can skip a
Mhm.
month. I don't want to get paid for something I haven't done. So they can, there's no, we call it, there's no long-term commitment. They can just, do it. Because we do have people that live in Aiken, part of the year. I have a lot of people that deal with horses. And so they come here for the winter and then they
Yeah.
go back up north for the summer, then they come back. So I'm not gonna, charge them money if they're not here. So so
Awesome.
they could just do monthly at the time. Exactly.
Awesome. Well, good deal, Dr. Dan. Thank you so much for
Yeah,
joining us on this morning. We appreciate you, and we'll see you next month, same
absolutely.
around the same time.
All right.
Absolutely. Thank
Thanks,
you.
Dr. Dan. Always good to have you on the show. We'll talk to you next time.
Thank you so much.
All right,
Bye bye.
Dr. Dan. All right, Jackie.
Yes,
Wow, that
God,
was
that was
awesome.
Dr. Dan Jolich, guys. So I mean, we clearly understand that we are responsible for our health.
Yes, we
You
are.
know, God has given us stewardship. We have to take a responsibility and be accountable first,
Hmm.
for our help. Nobody's going to do it for us. So we
Definitely
have
can't
to
worry
do
about the
it.
government
No. And
and
so
your insurance company.
and you see that, they're not paying for preventive care.
Mhm.
So you have to be careful of, I mean, even, and I wanted to mention, like, when we train, and work out, one of the doctors this past week, they said on our panel at the Wall Symposium, you got to do quality exercise. It's not so much about quantity, but quality,
Right, right.
because you want to be able to be sustainable and be able to still move
Throughout your lifetime. Right,
throughout your lifetime and not with back pain and all these other things. So,
right.
yeah, and with the thing with vertigo, and a lot of people go through that. I didn't heard a lot of people go through that,
Mhm.
especially, as you begin to age,
Right.
there's something about the inner ear or something
Mhm.
get uh, hit or damage a nerve or something. So anything, so things that can cause those causes vertigo. I'm sorry, I said vertigo.
Vertigo.
Vertigo. I said vertebrae. Vertigo. But yes, guys. So we hope you guys just take these nuggets. I'm telling you, this is awesome information. So take this stuff and just kind of self-educate yourself, and once you become aware, you have to take responsibility.
Most
You have to
definitely.
take responsibility.
No one to take care of you better than you. So
Amen.
it's up to you to get that preventive care. Listen, thank you for listening to Help Matters on this morning. We want you to like our Facebook page at Get Fit with Jackie Fitness, and we want you to subscribe to our YouTube channel at Help Matters Jackie and Coach.
Guys, remember, we're here to help you to become a better you, to be the best you that you can be. We like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you have a healthy and blessed day.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go. Come on, get up. Cause you tune into the station for your morning motivation to get your education for your health and your spiritual need. Yeah, strong will to empower the people, to promote the peace, though positive attitudes, behavior that's a lifelong trend goes. Yeah, health matters, and we're here to help you become the better you, to be the best you, the best version you can be. Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.